Hi everyone, welcome back. My name is Hina Mazarudin and I am your Vice President for PAs in Virtual Medicine and Telemedicine. Today I'd like to continue a series of where we highlight some of our amazing PA members and how they work in their respective fields and utilize telemedicine. My intention is that this serve as an opportunity for us to connect and network together and also to highlight our amazing members. You know, I believe that we are stronger together. So without further ado, let's get started. Hi everyone, welcome back. Thanks so much for joining us. Today I have another famous Instagram and TikTok star with us here today, who is a PA, Michele. Let me introduce you to her. Hi Michele, how are you?
I'm great. How are you?
Doing well. I'm so happy that you're able to join us today.
Thank you. Thank you for having me. I'm excited.
Thanks so much. Michele, can you start by stating your name, how long you've been a PA for, and the area of medicine that you practice in?
Sure. My name is Michele Neskey. I've been a practicing PA since 2005, so 16 years, and I work in adult medical oncology.
Wonderful. Thank you so much, Michele. Can you start by telling us a little bit more about your experience with telemedicine, specifically in oncology, please?
Yes. Our first experience, my first experience with telemedicine, really started in the pandemic when a lot of our patients who come from far away or just having their comfort level of coming to the office during the pandemic, obviously we wanted to try to change to a more virtual platform. Learning curve for both the providers and for the patients. A lot of our patients still come in for treatment and we couldn't change that. So there were still some patients that had to come for treatment, but for patients that just needed blood work or needed CAT scans and could just like get in and out, go home, and then we would call them with their results. That was where we really tried to take telemedicine into our practice, also in the surveillance setting. So anybody that had a history of cancer that was getting scans or blood work, we tried to have them do it locally if possible, and then do video visits as much as we could. So the learning curve was pretty steep for both providers and the patients, because it took us a little time to find a platform that worked well for everybody and integrated into our EMR. So that took a little time from the institution. But once we got kind of in the habit of it, it started to work out really well. And we still have a lot of patients that are still doing that because, we have patients that drive 2, 3, 4 hours to come see us. So it's been a nice way to offer them sort of interval visits over video where they could have blood work closer to home, and then we check on them over video. And so we're still doing that now. And the patients that have to come for treatment obviously still come to the office. So it's a nice hybrid of both kind of practices, which I like. I needed telemedicine in the clinic because, we have patients in the clinic still coming into the clinic, and then we have patients on telemedicine, and with scheduling and getting, I in the beginning, it was like, oh, I had a patient in person, a video, a telemedicine visit, and then another in person, and that did not work well. So we tried to sort of block the schedules for telemedicine only appointments and then in-person appointments if needed. So it's definitely been a transition, ups and downs, but overall, I think the patients are liking it.
Absolutely. And I exactly can echo the same sentiment when it came to this scheduling, because you're right. Even on our end, it becomes very fatigue. You get like the Zoom
Yes.
fatigue or this this internet
Yeah.
fatigue if you have to do it kind
And
of one after the other. It works better if we can block scheduling.
right. Yeah, I agree. And it's still happening to me now, but not as much. And now we have more cameras in the room. So if we have to sort of, we were dealing with like 2 computers with cameras for a provider area of like 6 people. And we're trying to, then we had iPads and the connection wasn't great. And the patients, some of them live in really rural areas because I'm here in South Carolina. They couldn't get reception. So a lot of times, I could hear them, they couldn't hear me, or vice versa. So we had to work through a lot of those technological challenges, particularly in the beginning. And there are patients that are really good at it and love it. And those are the people that are going to, keep doing it. And then there are other people that are like, I can't do this. I'd rather come to the office. And that's fine too, now that we're sort of moving back towards more normal operations. But it is nice to be able to have that telemedicine component particularly for patients that live far away.
Absolutely. So, like you said, it has its pros and cons. It's
Exactly.
and its
Yeah,
challenges.
exactly. Yeah, for sure.
Michele, can you share with us a clinical pearl or a word of wisdom with our PA students and our other practicing PAs, please?
I would say sort of my words of wisdom. would be to never stop growing, never stop, taking challenges and putting yourself sort of outside of your comfort zone. It's the way you learn, it's the way you grow. And I just feel that, over the past couple of years, even myself, trying to do some things that were different than what I thought would be my traditional pathway, taking some risks and really learning a ton, and being, just open to whatever opportunities come your way that you feel resonate with you and make you feel good. Sort of follow that instinct and look for opportunity and just never stop growing, and allowing yourself the opportunity to grow. That's what I would say.
Thank you. Those are excellent words of wisdom. And you definitely share that through all of your wonderful TikTok and
Thank you. Thank you very much. I appreciate it.
So I'm going to ask you a real quick bonus question because you have a great telemedicine story that I would like for you to share with our audience.
Yes. So I have a great telemedicine story. So I was at home, and I had a block of sort of telemedicine appointments, and I take care of lung cancer patients for the most part. And I was chatting with one of my patients, checking in with her, seeing how she was feeling. And she was sitting in her home. And during the conversation, I think I was on her phone. So she picked me up and walked outside of her house. And then while we were sitting and talking outside of her house, she lit up a cigarette. And so at first I was like a little bit like, okay, like she's comfortable in her environment, like, but we have my patients and I see each other a lot. So we have usually have a relationship. And I just looked at her and I said, are you smoking? Like, are you really smoking? Like, and she was like, oh, well, you know me, I'm trying to quit, but I'm not going to lie. I mean, I do have a cigarette every now and then. I was just dying laughing. I'm like, you know what? It's like, it was crazy, but kind of awesome at the same time that she felt comfortable enough to do her own thing, like while we were on the appointment. But then obviously I had to take that opportunity to say, smoking can decrease the efficacy of your treatment, kind of go into that. And she's like, yeah, whatever. So, but just really eye-opening and kind of funny that, a patient would light up a cigarette on a telemedicine appointment with their lung cancer provider. So just, you never know what's going to happen when you see patients in their house. So.
Absolutely. And that is the good and the bad of telemedicine, that you get to really see your patient in their natural environment at their home.
Right.
They're, a lot more free, and you get to notice a lot of interesting things about them.
That's right. Exactly. So, and, honestly, like if I had seen her on the street doing it, she probably wouldn't have, probably would have done the same thing. But kind of as we were talking before, we're so used to patients coming to us, and, we're really showing up in their home. And so it's a different environment for sure.
Absolutely. But thank you so much for sharing that story. And thanks everyone for watching. And we look forward to connecting with you again.
Take care. Thank you so much. Have a good one.